let's go over week 9 meds for you guys, and then we will kind of get moving. Okay, so week 9 meds. Crestor or rosuvastatin, okay, is a statin. We know that's for hypercholesterol, hyperlipidemia, prevention of atherosclerosis, which is cholesterol, fatty plaque buildup in the blood vessels. Side effects: myalgia, arthralgia. Remember, algia is pain, so myalgia is muscle pain, arthralgia, joint pain, dizziness, headache. Remember the myopathy, that's for all of the statins, is the risk for myopathy or rhabdomyolysis, liver damage. Those are all things that are with all statins. Excuse me. Advair is the purple disc that you take for like COPD or asthma. It's a combo drug. It has a bronchodilator and a steroid, so it helps to open up the airways as well as decrease inflammation for chronic asthma or COPD maintenance. This is not an emergency drug. This is not like albuterol. Let me take it in the event of an emergency. It's not going to help. It can really cause throat irritation or thrush, that white coating, kind of candidal infection of the tongue, sinusitis, headache. It can cause upper respiratory infections, musculoskeletal pain. The steroids, of course, we know what steroids cause: immunosuppression, growth effects, pneumonia. Those kind of, not most steroids themselves don't necessarily cause pneumonia, but it says take precautions with MAOIs and TCAs. Watch for low potassium with diuretics. It's contraindicated with acute asthma, so you don't want to take it when an acute asthma attack. So look, orally inhaled, you always rinse the mouth afterwards. So they always tell them, so once they take it, to rinse out their mouth, rinse it and spit it out so that they won't, because some of that will stay in their mouth if they don't. Trazodone is an antidepressant. Dry mouth, dizziness, drowsiness, nervousness, change in sex drive, as there are with most antidepressants. Weight changes. Again, most antidepressants can cause weight changes. Of course, there's always a risk for worsening depression and suicide. Increased levels of digoxin and phenytoin levels when you give those. Phenytoin is for seizures. And then make sure that you watch it with Coumadin. Fosamax is a bone resorption inhibitor. So basically it helps for osteoporosis. And then for Paget's disease, another one. Osteoporosis is probably the most common one there. Indigestion, abdominal pain, and nausea. Has to be really careful. It can cause like major indigestion. And look at the effects on here specifically. Take at least a half an hour before any food or drink in the beginning of the day with a full glass of water. So don't want to take it with anything else. And they need to sit up for at least 30 minutes after they take it, because it has a really high risk of like heartburn and damaging the esophagus. The other thing that's specific to this medicine is it's usually prescribed and you just take 1 pill a week. So it's just a weekly pill. Take it every week on the same day. Look at the contraindications for a second. It has trouble when you retake calcium with it. Increased risk for GI irritation, especially if they're taking NSAIDs, which also have a risk for GI irritation. Contraindicated with esophageal disease, or if they cannot sit up for that 30 minutes, you don't need to take it, because you need to be able to sit up after you take it so it doesn't regurgitate into the esophagus. Allegra, fexofenadine, allergy medicine. It's an antihistamine for allergic rhinitis, runny nose, allergy symptoms. Side effects are dysmenorrhea, so painful menstrual cycles, headache. Don't want to take this. It says grapefruit, orange, and apple juices decrease its availability. So they decrease the amount that's actually available for your body to use. Mevacor is lovastatin. It's another statin. So again, it's for high cholesterol. Same ideas. Category X, pregnancy, like all statins. Myopathy, rhabdomyolysis are your adverse effects. No grapefruit juice, notice with this one. Liver disease, you don't want to give it with that. Coreg or carvedilol, can't talk, is a beta blocker. See the LOL at the end there. It's for chronic heart failure or if they're left ventricle dysfunction, post myocardial infarction, hypertension. Notice side effects are bradycardia, so you don't want to take this if they've got a low heart rate. You don't want to take carvedilol if they already have a low heart rate, because it's going to make it lower. Hypotension, fatigue, nausea, diarrhea, dizziness, hyperglycemia, weight increase, fluid retention, lots of side effects. Really want to be careful when you give it with digoxin or amiodarone, because those also have a risk for bradycardia, and this can combine with that and really lower their heart rate. Careful with diabetes. Of course, asthma, because it's a beta blocker, and remember asthma, those asthma medicines work, they're the opposite. Excuse me. Don't want to give with COPD, same idea. Take with food, you don't want to stop it all of a sudden, and you want to be sure that you monitor their pulse. Paxil or paroxetine is an SSRI, major depressive disorder, obsessive compulsive disorder, panic disorder, social anxiety, general anxiety disorder, or post-traumatic stress disorder. So lots of psych disorders. You can use this one for. Side effects: asthenia, which has to do with movement, sweating, nausea, decreased appetite, somnolence, so the sleepy, drowsiness, dizziness, insomnia, can go both ways, tremor, nervousness, ejaculatory disturbance, dry mouth, sweating, decreased libido, so decreased sex drive. Most antidepressants have that. Pregnancy category D. Of course, there's an increased risk for suicide, worsening depression, monitor for increased bleeding. Mobic, the next medication, or meloxicam. This is an NSAID, just like ibuprofen, osteoarthritis, rheumatoid arthritis, juvenile rheumatoid arthritis. So it's specifically for those. Stomach upset, just like all NSAIDs, have a risk of stomach upset, headache, upper respiratory infections. Look, pregnancy category D for greater than 30 weeks gestation. And that's because of the risk for bleeding. Okay, so you have to be really careful, especially later on in pregnancy with NSAIDs. It's not something that you want to take. Monitor cardiovascular status because of an increased risk for MI, just like all NSAIDs, or all NSAIDs. Ulcers, bleeding, kidney function, blood pressure. Contraindicated with the cabbage. Remember, cabbage is coronary artery bypass graft. That's open heart surgery. Monitor kidney function, because usually when I kind of remember, Tylenol has bad effects on liver, ibuprofen, worse effects on kidneys. And then the last one on here is Avapro, irbesartan. Remember, Artan is for these angiotensin II receptor blockers for hypertension or diabetic nephropathy. That's interesting. Diarrhea, heartburn, nausea. Category D, as far as pregnancy goes. Be really careful with kidney impairment and then with the kidney function. Okay, so that's this week's medications. There were a couple of abbreviations on this week's I wanted to go over too. So go to set 10 of your abbreviations real quick, or set 9, I'm sorry. The major ones I wanted to talk about are IVP and IVPV. So IV is intravenous. That's like, you guys know what an IV is. Whenever you give medication, it goes directly into the vein through a little catheter that you place in there. Okay, an IV push is whenever they take a syringe. This is an insulin syringe, so this is probably not my best example. But anyways, it's whenever they put medication into a syringe, and then they use that syringe to give you the medicine through the IV. Okay, that's called an IV push. Okay, so they give you, it's kind of like a little bolus of medicine. They give you all at one time. Like, let's say you're sick and they want to give you some anti-nausea medicine. Okay, they might give it, give however many milliliters of it into the IV through with a syringe. Now, an IV piggyback, okay, this is where, and you guys have probably all seen, somebody has an IV and they have a bag of fluids hanging up. Well, an IV piggyback is where you have like an added fluid to give through the IV. So let's say they're getting regular normal saline through an IV. Okay, then, but they at 2 o'clock they need their antibiotic. Well, I have a new bag with antibiotic in it, and I hang it. You actually hang it above where the other fluid is, and that makes it. That actually gives a little more push. I don't know, I shouldn't use the word push, but that actually causes that antibiotic to go on in through the line. That's if you need to give something over like a long period of time. An IV push is something you give right then. Usually you give it in like 1 to 2 minutes. You push the drug kind of slow over 1 to 2 minutes. Versus a piggyback, you could set it up on like a pump and say you want it to go in over 30 minutes or over an hour. So you give that medicine slowly over that 30 minutes or an hour. So that's what that is referring to. Everything else in here is pretty self-explanatory. The one thing I do want to say on here, it has IU. Sometimes you'll just see it as U. You're actually, that's not an approved abbreviation anymore. People will still use it for units, like units of insulin, but that's not actually approved anymore. So you're supposed to just spell out the word units instead of use an abbreviation. I put it on here because people still use it. But whenever you're writing it out, you just use units. Don't ever use that abbreviation. Okay, and that's that for week 9.